Hello, a very good morning to all of you. So welcome to my channel Inspire Pharma. In my last video, I have discussed you about the certain important definitions of the pharmacology. I have described about you the what is pharmacokinetics, what is pharmacodynamics, what is pharmacology, what is drug response curve, or what is dose response curve. So that are the introductory definitions of the pharmacology. Means before you go about the classification of the drugs, discussion about the specific drugs against the specific disease, we must understand about this introductory definitions. So another important definition or the difference you have to understand is the efficacy versus potency, or comparison of efficacy and the potency. You are going to deal with these two words in almost in every chapter of the pharmacology. So to make you familiar with these two terms, I am making this very important video. So here, just wasting without so much time, just let's discuss and concentrate on this topic. So here, first of all, you're looking at image. In every image or in every graph, there are the two axes. One is x-axis and one is the y-axis. On the x-axis, you are looking at the log drug concentration, or on the y-axis, you are looking at the biological effects or the pharmacological response or the drug response that is produced by that drug. So here you are looking at, first of all, I must give you the definition of the potency. Here again, you are looking at another term, that is EC50. You are looking at EC50 for the drug A, EC50 for the drug B, and EC50 for the drug C. Okay, so now what is this EC? EC50, it means that 50% concentration of the drug, kitni concentration of the drug, or how much concentration of the drug is required to produce the 50% of the maximum biological response. Now 100 is the maximum biological response as you are looking at this. Okay, 100. Okay, and 0 is the minimum response. So obviously the 50% is the 50% of the average biological response. But the 50% जो है, that is a half of the maximum biological response. Now looking at, if you compare these three drugs, drug A, drug B, and the drug C, that drug A is producing that 50% of the maximum biological effect at the low concentration as comparison to the B. Suppose here it is 0, here it is a 30 mg, here it is a 60, or it is a 90. Suppose let us guess this. So it means the drug A is producing the 50% of the maximum biological response at the 30 mg, it is producing at 60 mg, or it is producing at 90 mg. It means out of this drug A, B, and the C, the A is more potent than the B, and the B is more potent than the C. Here again they have also mentioned this, that drug A is more potent than the drug B, and the drug C show lower potency or when both the drugs B se bhi kam hai and A se bhi kam hai. So I hope you are clear with the definition of potency, that dose which is required to produce the 50% of the maximum biological response of any drug. Clear with the definition? Now let's discuss what is efficacy. You are going to study that this drug is has a more efficacy than the B. Suppose must know that aspirin and paracetamol. Suppose if I say that paracetamol is have the more efficacy than the aspirin. Suppose A is a aspirin, B is a paracetamol, and C is a nimesulide. So if I give you the definition of efficacy, so efficacy, what is the meaning of efficacy? The meaning of efficacy is that dose of the drug which produces a maximum biological response, or the maximum biological response produced by any particular drug, okay, at particular dose. Okay, so it means this both drug is showing the same biological response, having the same efficacy. They are producing the same biological response at the same dose, but C drug is having the lower biological response at the maximum dose even. Okay, so here they are having the more efficacy, they are producing the maximum biological response at the same dose. Okay, so it means both the drug A and B is having the same efficacy. If you compare this graph, they are producing a 100% response at almost the same dose. Okay, So it means this is having the same efficacy but C drug is having the lower efficacy. तो efficacy का मतलब क्या होता है? Maximum biological response produced by any particular drug. Okay, so I hope you are clear with my definition of the potency and with the efficacy. Okay, potency is what? The dose at which a particular drug is producing the maximum 50% of the maximum biological response. 100% is the maximum biological response and 50% is the half of that. So that drug is showing at the low dose. It means कि वो कम dose पे भी maximum का 50 produce कर रहा है, उनको 50% प्रोड्यूस करने के लिए हाई डोज की नीड पड़ रही है. इट मींस दे आर हैविंग द लेस, दे आर द वेरी लेस पोटेंट ड्रग्स देन द ए. Or if you look at the efficacy is a 100% biological response. So this is the 100% biological response. This is the 100% biological response of this. Okay. So efficacy का मतलब जैसे ये होता है कि if any particular drug is able to produce the 100% biological response, not we compare the dose. We are just कि if any particular drug is able to produce the 100% of the required response. However, because its potency is A's potency is more than the B, so it is producing the maximum biological response at the lower dose. But it is producing 100%. B is also able to produce 100%, even it produce at a higher dose. But their efficacy is the same. Means if any drug is able to produce the required pharmacological effect or not. Just forgetting about the dose. So this is the comparison of efficacy and the potency. So I hope you are clear with my definition, with my explanation of the efficacy and the potency. So we will meet in our next video with another important definitions of the pharmacology. So keep supporting Inspire Pharma. I will meet you in my next video with more interesting content. So like, share and subscribe my official YouTube channel Inspire Pharma. Thank you. मिलते हैं next video.